In this video, I will show you 5 of the best exercises for SI joint pain relief that may help to reduce pain, improve movement, and make everyday activities more comfortable. These exercises are gentle and easy to follow, and they don't require any special equipment. So let's get started. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Aurelia, Ontario. If you have SI joint pain, you know how frustrating it can be. Simple things like getting out of a chair, rolling over in bed, climbing stairs, walking for too long, or standing on one leg can trigger that deep ache around your lower back, buttock, or pelvis. You may even feel like your pelvis is out of place or unstable. If that sounds familiar, try these exercises and they may help. This routine is designed to gently improve the way your pelvis moves and activate the muscles that support the SI joint and build better stability. All of this may help to reduce pain and make everyday activities feel much more comfortable. So the first exercise we're going to do is called the adductor squeeze. This exercise is to help the muscles that stabilize the SI joints, the adductor muscles along the inner thighs on both legs. This works with your pelvic floor muscles and your glutes to help keep the pelvic ring strong and stable and protect the SI joints from being strained. So the way we're going to do this exercise is you want to use just a carpeted floor or a yoga mat, and you're going to lie on the floor on your back with your knees bent to 90 degrees. So in a position such as this. Once you're in this position, you're going to take, I have a rolled up bath towel, but you can use a bath towel, a pillow, a cushion, or a foam roller, and you're going to place that between your knees with your feet flat on the floor, your knees bent to 90 degrees. You're going to lie back and relax. Take a nice deep breath in. And as you let it out, you're going to squeeze your knees together at about 25% of the force that you could maximally produce. So about a 25% force squeeze of your knees together, and hold that for 5 seconds. Then you're going to relax for 5 seconds. And then you're going to repeat by squeezing, again, about 25% force with your knees together. You're going to repeat this for 10 repetitions. So 5-second squeeze, 5-second relax for 10 repetitions. And I recommend to do this about 3 to 5 times per day. So every 10 repetition sets performed 3 to 5 times per day. Now, when you're doing this, you should feel an activation of the muscles just in between your thighs, as well as you may feel a little bit in the SI joints and in the back and the core muscles as you activate this. The idea is to kind of wake these muscles up or activate the muscles that your body uses to help stabilize your pelvis. Now, when you're doing this, you should not feel sharp pain in the SI joints, the lower back, the lower abdomen, or the inner thigh. You should just feel a light engagement. If you do feel like it's too much, just back off with how hard you're squeezing, or possibly use something just a little wider to keep your knees slightly further apart, like 2 pillows or 2 towels. Okay? But the best idea is just to ease up on the amount that you squeeze, and as you improve over time, you can build this up a little bit more. Once you're done, you want to get up and just walk around a little bit to re-engage those muscles, and you should feel a little ease and tension in the lower back and the SI region as you do this. Now we'll go on to the next exercise, which is one of the stabilizing muscles for the SI joints, the glutes. So the next exercise we're going to show you, the second one, is the glute exercise. And this is a strengthening exercise for the muscles that stabilize the SI joints. So the way we're going to do this exercise is we're going to, again, use a carpeted floor or a mat. Lay on our backs with our knees bent to approximately 90 degrees, just so the heels are just beyond the tips of your fingers. Knees are about shoulder width apart. And the glute muscles are extenders of your hips. So when we contract the glute muscles in this position, it's going to raise our torso up off the ground. So in order to do this exercise, what you want to do is place your hands flat on the floor, engage your core. So just tighten up your abdomen slightly as you do this. Take a breath in. And as you let it out, just push your core or your pelvis straight up in the air. So the upper body, your torso, and your upper legs are lined up. Hold that for 2 seconds and then release. Take a breath in, and as you let it out, you can do that again. Raise it up to a straight, hold for 2 seconds, and then release. You can do this for up to 10 repetitions, and I recommend it doing about 3 to 5 times per day. Now, when you do this activity, you should feel, again, a little bit of a tightening, obviously, in the glute muscles, maybe slightly in the lower back or in your core. That's all right. If you do feel sharp pains or any discomfort or pulling in your hamstrings, one thing to watch is sometimes people will push with their toes. You don't want to do that. You want to push through your heels as you're doing this. And if you do find raising all the way up starts to bring you problems, just raise about halfway until you don't feel any discomfort, and then you can release back down. As this improves and strengthens, you'll find that you'll generally be able to have more range and hold for longer periods of time. So I recommend starting at 2-second intervals, 2 seconds up, and then release, 2 seconds rest for 10 repetitions. But as you improve, you can start building it up to 30-second holds between. Again, for 10 repetitions, you can perform this 3 to 5 times per day. So now that we've engaged the glutes and strengthened the glutes and are improving the stabilizing muscles for the pelvis, the next exercise we'll get to is stretching of the lower back and pelvic muscles to gain more mobility.
The third exercise we're going to get to is called the knee to chest stretch. This is a stretch for the muscles across the lower back and pelvis that will help just to create more length and a little more mobility in those muscles in the SI joints. So the way we're going to do this is we're again going to lie back on a carpeted floor or a mat. And as we do this, we can either do it with our knees bent or our legs flat out, whichever is more comfortable. But what we're going to do is we're going to do one leg at a time. So in this case, I'll just leave my opposite leg flat out. And what we're going to do is as we're laying in this position, we're just going to breathe and relax nice and easy. We're going to take our fingers and lock them across our knee. Now, if you find that you're not that flexible and you can't reach that, you can just use a towel wrapped around your knee and pull with that. But what you're going to do here is bring your knee, and you're just going to pull one knee straight up to your chest. And as you do this, you want to just breathe and relax nice and easy. So I find the easiest way to do this is take a breath in, and as you let it all out, just bring the knee up towards your chest. Now, as you do this, you want to hold this stretch for about 10 to 30 seconds for each side. And you want to breathe and relax nice and easy. And you should feel just a gentle pulling in your lower back and the back of your glutes. You should not feel any sharp pains. You should not feel any numbness or tingling. If you do find it's too sharp, just ease up a little bit. As you do this stretch and progress through this stretch over days or weeks, you'll find it'll improve significantly. Okay, so you hold that stretch for again 10 to 30 seconds. And then you can relax it. And then you can bring the other leg up. And you can do the same thing. So breathe in, breathe out, and draw it up. And again, hold for 10 to 30 seconds. Now, one more slight variation you can add to this if you wish, if you find your flexibility is quite good, is you can just rock the knee in and out slightly as you do this. This just helps to engage the SI joint a little bit and create more mobility through the SI joint. And then let it down. So again, when you do these stretches for each leg, hold it for 10 to 30 seconds, and you can repeat that 3 to 5 times per day. The next exercise we're going to get to is an engagement exercise. And what this does is it helps to wake up the nervous system so it fires and coordinates all the muscles that work to stabilize the pelvis. The fourth exercise we're going to do is called the bird dog. This exercise is meant to help strengthen and stabilize the muscles of the pelvis, lower back, and glutes. This is important not just for the strengthening aspect, but more importantly for the coordination aspect. In people who have jobs, especially jobs that require a lot of sitting in a chair or in a car, the muscles become out of balance as far as strength, but they also become uncoordinated in the way they move. And these uncoordinated movement patterns can lead to lower back, pelvic, and SI joint pain. So the way we're going to do this exercise is, again, we're going to use a carpeted floor or a mat. We're going to position ourselves in a hands and knees position with our hands directly below our shoulders, our knees directly below our hips. And the idea behind this exercise is we're going to coordinate one arm and the opposite leg being extended at the same time. And this again helps to coordinate the muscle patterns that fire in the low back and pelvis. So the way we do this is we're going to just breathe easy, engage your core, so just tighten up your abdomen just so your lower back is nice and flat. And what we're going to do is we're going to extend our left arm ahead in front of us and our right leg behind us at the exact same time and hold for 2 seconds. And then we're going to bring them back down. Take a breath in And again, as we let the breath out, this time we're going to raise the right arm and extend the left leg. 2 seconds and bring them back down. And when we do this, we can repeat this for 5 to 10 repetitions with those 2-second holds. Now, if you do have trouble with this, you can shorten up the holds, or what you can do is just use one arm without the leg and then do the other arm. So just move one limb at a time, and then you can do the same one leg at a time as you do this. As you improve and strengthen and improve your engagement and improve your coordination, you'll find that it'll be a lot easier to do 2 limbs at the same time. Now, one of the problems people will often make with this exercise is we're in this position, is the lower back arch too much as they're doing it, and that can create discomfort in the low back. So just making sure your lower back is flattened out, and you just tighten up your abdomen slightly as you're doing this. Now, this exercise you want to do, again, 2-second holds, 5 to 10 repetitions, and you can do that 3 to 5 times per day. As you improve, you can actually do longer holds. So what you want to do is, they have a 2-second hold, you can do a 5 up to 10-second hold as you do these. The 5th exercise is called the pelvic tilt. This is an excellent exercise for teaching your body how to engage and coordinate the muscles around the pelvis and lower back. It helps to loosen the SI joints, the pelvic ring, and the muscles in the lower back. Now, normally when you do this, you just do it on a firm chair. It can be a kitchen chair. I'll use a bench just so you can see what I'm doing. But what you're going to do is you're going to sit on the bench or chair, nice and straight, feet flat on the floor. And when you do this exercise, you want to just rest your hands on your lap comfortably. I'll just hold my arm up just so you can see what I'm doing here. But when you're doing this exercise, what you're going to do is you're going to relax, breathe nice and easy, and you're going to let your pelvis rock forward as far as you can go. Basically, let your belly hang out. And then you're going to tuck it back underneath you. And as you do this, you're going to rock from one to the other slowly with about 1 second in between. The whole time you're doing this, you want to just breathe and relax nice and easy. And as you're doing this, you want to just feel the muscles of the lower back and of the core engage. Now, when you're doing this, what you want to do is hold it for about 1 second in each position. You want to do a total of about 10 repetitions, and you can do this 3 to 5 times per day. Now, when people have problems with this, it's usually because they're either A, moving too extreme or too quickly with this, or they're holding their breath. So breathe, relax, rock forward, rock back, 10 repetitions, 3 to 5 times per day. And then once you're completed that, get up and walk around. You should feel more looseness, more engagement, more mobility in through the hips, the pelvis, and the lower back.
In this video, I showed you 5 exercises for SI joint pain relief that may help to reduce pain, improve pelvic stability, and increase mobility, and help to make everyday activities like sitting, standing, and walking more comfortable. Remember, these exercises often work best when they're performed together as a routine rather than individually. If you followed along with these exercises, which one gave you the most relief? Was it the adductor squeeze or the bird dog? Drop a comment below and let me know. And if you found value in this video, please give it a like and share it with someone dealing with SI joint pain. Doing that helps more people find practical, non-surgical solutions that may help them move better and feel a lot better. Be sure to subscribe if you want real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms, so you know exactly what to do next. Now, if you'd like to learn how a leg length discrepancy may contribute to low back pain and SI joint problems, go and watch this video next. I'll show you why a short leg can matter and how it affects your movement, and explain how we help patients move with better balance and less pain.